Hi everyone, my name is Brenda and I am an educator and rep for AOMed. Today we are going to be demoing the UR system. So I've already got my client numb, and what you want to make sure that you do is take the numbing cream off as you go. So I'm going to take all the numbing cream off with the alcohol wipe, and then I'm going to do the growth factors on top. This is our Fill a Shine. And then I'm going to go ahead and get the machine going. So I have this on 0.5, and the vacuum is off, but you can have it on normal or soft. And then you just hit the button and it engages. So with this machine, you have 25 fractional insulated needles that are going down into the skin. And the energy, which is the RF, actually creates a three-dimensional kind of treatment. So what happens is the RF is not going to be heating up the skin on top, but it's down inside. So again, I'm going to show you this. This is the vacuum. You can totally have that off if you want. I actually have her on 0.5. This machine is similar to the Scarlett or the Morphus 8, which is also microneedling and radiofrequency. The difference between ours and those two machines is this also has a little bit of a vacuum on it, and the needles are, like I said, insulated and fractional. Now you can kind of see where she's starting to get a little bit of the stamping on there, and that is exactly what you're looking for. You can set up the speed on the machine by 1, 2, or 3, or even more. If you have it on 0 seconds, you're just applying it, pushing this over, and then it's engaging. Now on this machine, I have her on 0.5. The RF level is 1. That is the strength of the radiofrequency. The emission time is 100. That is how long the heat is staying inside the skin. And again, I have it on 1 second, which is not super fast, but it's pretty fast. How's that feeling?
Great.
So I'm going to go ahead and go over to her face, the side of her face, the cheek area. You can totally customize the depth of this. So by the little knob here, so it goes to neck, forehead, we're going to do cheek, so it goes to 0.8. This is the default setting. It also has a radiofrequency of 2. The emission, which is how long it stays in the skin, is 150. I have it on the interval of 0 seconds, and I have the vacuum off. When I'm doing the treatment on a first-time client, I will either have the vacuum on 1, which is soft, or I'll have it off completely. It's really based on what your client's comfort level is. The vacuum actually helps it be more comfortable for your client, but sometimes they're not really totally used to it. Now, some treatments that this is really, really good for is your pore size. Of course, we know that that's the biggest complaint with most of our clients. They want their pores to look smaller. Acne scarring. Wrinkles. This will actually help with birthmarks. Now, whenever I'm doing the cheek area, I start down here at the jawline, and I just do 50% overlay. Again, looking for the stamping and doing the 50% overlay. This is 25 needles. They're insulated. And on the first video, part 1, I show a picture of the needles. Don't be concerned about if you smell anything. It's not frying the skin. It's just the energy from the radiofrequency. So we'll take a little bit of a break. Do more growth factors. Now, one reason why I like these growth factors, and this is the Fill a Shine, is because your clients are going to see this instant glow on their face when they leave, and they really, really like that. So see, she's getting a little bit red, nothing severe. You can go as many passes as she feels comfortable with. When it gets to pinpoint bleeding, I always stop. Of course, always go by their comfort level. You may not need 4 or 5 passes, okay? So when you're seeing the stamping on there, that's perfectly normal as well. So I'm gonna go to the chin area. Again, you wanna make sure that you have a bunch of alcohol wipes because you're taking the alcohol and removing the rest of the numbing cream. You can do this on the neck. You can do this on stretch marks and other scars on the body. This goes from a 0.5 to a 3 millimeter, which is plenty deep enough to go in and do whatever you need to, even on the body. So I have all the numbing cream removed. One reason why I like removing the numbing cream as I go is because it's going to help them stay numb. Okay, so I'm going to go down here to, I'm probably going to do, let's just do the forehead for this. You can do the forehead and the cheek area or the chin, or totally customize it as well. So I could totally do, it's set on 0.5 right now, I could totally have it at a 0.6. So you just want to hold their skin taut. Press it and do the silver button. Now, I would not do the top of her lips. I would not do her scalp. But everywhere else, you can do that. And I'm going to show you here in a minute how you can get around the eye area. You're not obviously going to do it on top of her eyelid. And you're not going to get in this soft tissue part, but you can get pretty close. And I'm going to show you that here in a minute. So we've already done her forehead, her cheek, her chin. Sometimes I'll go above their lips if that is a concern for them. Again, you want to be careful when you're doing that. Next thing I'm going to show you is underneath the eyes. Now, another tip that I have is I typically, and I did not do this with Melissa this time, but I typically will start off with the left side of their face because that, for some reason, because that's the side that your heart is on, that seems to be a little bit more sensitive. Now, what I'm going to do with this, I'm going to come back up here to my setting, and there's a specific setting for the eye area. It's a 0.5. I'm going to keep the RF at 1. And you can totally customize the emission time too. So I'm going to hit the emission button, and I'm going to dial this down just a tiny bit. I'm actually going to take it to 100. So I have it on 0.5. RF is on 1. The emissions is 100. I have it in 0-second intervals, and the vacuum is off. So what I do in the eye area, again, I'm going to get a little bit of growth factors. So what I do, and you don't want to just yank down on it, but you're going to kind of pull it down from the squishy part here and kind of do it right on the bone. You can totally move the headpiece around too, so if you feel like that this is in the way or it's kind of awkward, you can totally spin it however you want to. So see, and I don't even have my finger on it, so it's not going to engage, but you're going to put it right in that area there. So this is great for your clients that they're like, you know what, can we do something with the crow's feet? And again, I don't have it in the soft tissue, so whenever I pull it down, it's going down to where you want it to be. And then whenever I release it, it ends up being right there. Now, the last thing we're going to finish with is I'm going to show you how I do the nose. Because this isn't really tricky and it's not really as painful. Now, I'm not going to have Melissa take her nose ring out, so I'm just going to show you the top of it and the side. But this is an amazing treatment to do for the larger pores on the nose. We always hear our clients talk about, oh, can you do something with the pores on my nose and all of this, and so this is wonderful. So for demo purposes, and since she doesn't have really large pores on her nose, I'm going to keep it on the lowest setting just for her comfort level. Now you can go obviously as deep as you want, create the intensity on the RF, but you don't have to start out of the gate super intense because you're going to be doing more than one treatment with them. Okay, so I'm going to go like that. What you're going to do for the side of the nose, you're going to brace your finger on this side, and she has a tiny little nose. So you want to make sure all the needles are on the nose. So you're just going to kind of have to move it around a little bit and see how I'm kind of stretching the nose a little bit. Now, she's going to see, she doesn't have large pores on her nose, but in about a week time, those pores on her nose are going to be almost invisible. And she is going to love it. So you can do that a couple times to do the top of the nose. Again, do more growth factors. You can't over apply the growth factors because it's so beneficial. And it really kind of depends on the client. Sometimes I'll just use one bottle of the growth factor. Sometimes I'll do two. It just really kind of depends. So on the top of the nose, I'm kind of pushing down on the tip to make it a little bit flatter. Taking it off standby. And then you can kind of just like, making sure that they're breathing out of their mouth. But if I'm wanting to get towards the tip, I'm just kind of taking my finger and making sure the nose is flat. And there you go. You can do this treatment every 4 weeks, 6 weeks, depending on how deep you're going. Again, you can do this on the body. You can do it on anywhere that there's scarring, things like that.